Caplacizumab for acquired thrombotic thrombocytopenic purpura. Definition: acquired thrombotic thrombocytopenic purpura is a potentially life-threatening thrombotic microangiopathy resulting from systemic microvascular thrombosis and leading to profound thrombocytopenia, hemolytic anemia, and organ failure of varying severity.
We've presented a trial which is a randomised trial looking at a new type of therapy called an antibody. This is a very important molecule which can act specifically and be manipulated to prevent the platelet VWF binding. It was a randomised trial where patients received standard therapy and they either received drug or placebo before plasma exchange was started, and this was continued following plasma exchange on a daily basis for up to 30 days after achieving remission. And remission is defined by normalisation of the platelet count.
Application in medicine. Caplacizumab, an anti-von Willebrand factor humanized single variable domain immunoglobulin nanobody, inhibits the interaction between ultra-large von Willebrand factor multimers and platelets.
It's called ADAM-TS13. Platelets coexist with many clotting factors. One is called von Willebrand factor, and it catches the platelets, helping them to clot. Imagine tennis balls caught on strands of flypaper. To keep the platelets from clumping together too much, ADAM-TS13 cuts through the von Willebrand factor and allows the platelets to continue moving. Inhibiting ADAM-TS13 allows dangerous blood clotting throughout the body and causes TTP.
Pros. Caplacizumab immediately inhibits the pathophysiological mediator of microthrombosis. Cons. Due to the presence of inhibitory autoantibodies, decreased ADAM-TS activity leads to an accumulation of ultra-large von Willebrand factor multimers, which bind to platelets and induce aggregation.
These are typically healthy young people who all of a sudden get dramatically ill.
Just take some deep breaths in out through your mouth, Catherine.
Dr. David Ginsburg is a practicing physician.
Sit back up there.
He's been researching the clotting system for the past 25 years. Dr. Ginsburg and his team at the University of Michigan in Ann Arbor discovered the crucial enzyme being blocked in TTP. It's called ADAM-TS13. Platelets coexist with many clotting factors. One is called von Willebrand factor, and it catches the platelets, helping them to clot. Imagine tennis balls caught on strands of flypaper. To keep the platelets from clumping together too much, ADAM-TS13 cuts through the von Willebrand factor and allows the platelets to continue moving. Inhibiting ADAM-TS13 allows dangerous blood clotting throughout the body and causes TTP.
Application in Ecuador. In Ecuador is not already distributed the clinical use of Caplacizumab for acute thrombotic thrombocytopenic purpura, but this type of treatment will upgrade the clinical potential of your country in order to handle in a better way this case.
So let's take a closer look into this congressman's disease, which is TTP-HUS. Just to give a brief background, my name is Dr. Daniel Heckman, and I am a dermatology resident at the Medical College of Wisconsin. I am also a national board reviewer for First Aid and Pathoma, the top 2 board review companies in the United States. So let's take a look at the mechanism then of TTP and HUS. In everyone's blood vessels, there's a protein called von Willebrand's factor that's normally broken down by an enzyme into smaller subunits. However, in the disease of TTP, these individuals produce antibodies that actually bind to and inhibit the enzyme. Similarly, in a disease called HUS, bacteria release toxins that then inhibit this enzyme. So whether this enzyme is inhibited by an antibody or a toxin, it still is inhibited. And without function of this enzyme, the von Willebrand's factor proteins are not broken down, and the blood vessel lumen becomes very narrow. The problem with having a narrow lumen is that red blood cells cannot fit through the blood vessels and smash into the large von Willebrand factor proteins. And what's left of them are fragments, as we see here. Here's a sample of blood from people suffering from this disease, such as the congressman, and we see fragments of red blood cells. So the treatment of this disease is to prevent the inhibition of this enzyme, which means we have to stop the formation of these antibodies or stop the formation of this toxin. So to stop the antibodies, we can administer steroids, which prevent the synthesis of antibodies from immune cells. However, once the antibodies and the toxins are already in a patient's bloodstream, the only thing we can do is filter them out through plasmapheresis, which is a quick and effective way to remove the offending agents from the bloodstream.
Conclusion. Caplacizumab induced a faster resolution of the acute TTP episode that did placebo. The platelet protective effect of Caplacizumab was maintained during the treatment period. Caplacizumab was associated with an increased tendency toward bleeding as compared with placebo.
Acquired thrombotic thrombocytopenic purpura is a potentially life-threatening condition caused by an autoantibody to ADAMTS13. Reduced activity of ADAMTS13 leads to the accumulation of ultra-large von Willebrand factor molecules that can bind to platelets and induce aggregation, leading to systemic microvascular thrombosis. This in turn can cause severe thrombocytopenia, hemolytic anemia, and multi-organ failure. Caplacizumab is a nanobody, a single monomeric variable antibody domain that targets von Willebrand factor and blocks interactions with the GP1b receptors on platelets. Investigators conducted a Phase 2 single-blind study at 56 sites worldwide, randomizing 75 patients with acquired thrombotic thrombocytopenic purpura to receive either caplacizumab or placebo, in addition to standard of care treatment, daily plasma exchange, and immunosuppressive therapy. As compared with standard treatment plus placebo, standard treatment plus caplacizumab reduced the median time to recovery of platelet counts. Exacerbation of thrombocytopenia within 30 days after the end of daily plasma exchange was also less frequent with caplacizumab, but bleeding-related adverse events were more frequent in the caplacizumab group. Thus, caplacizumab induced a significantly faster resolution of acute acquired thrombotic thrombocytopenic purpura than did placebo. Full study results are available at nejm.org.